Check 1, 2.
Well, hello there, boyfriend. How are you this fine day?
I'm really good.
Is it working?
Yes.
Excellent. Let's not touch shit.
I'm afraid to ask, but I have a great question.
I don't even know what I was going to say. I'm so disturbed right now.
This is afraid to ask. I feel bad because we owe the listeners an update on your back situation. Because I think the last time I don't know for sure, but I think the last time we talked about it, you were about to go for surgery?
The next day. And you said, like, we'll follow up when everything's good or something. And I was like, don't jinx me. And you were like, no, I'm being positive. I'm putting positive stuff out there. And then, I had surgery the next day.
You had surgery the next day. And then it was really, you had to have the back surgery. I'm not saying that I had to do anything, but it was really difficult. They say, we're going to text you. I couldn't go in with you, which kind of upset me.
You should have been allowed. I don't know why they wouldn't let you, because there were
Could you hear me burping
chairs.
Through the...
Sexy, but not...
That's what was upsetting. I was okay with it when they go, you can't come back. It's like, oh, maybe you can't. But then when you said, there's 2 chairs in here.
Yeah, and they had me sit for like a good hour and a half. I was super anxious. I would have much rather had you be with me.
We were like...
I don't know why. It was somebody new.
We were like 20 yards away from each other in a hospital, and I was just sitting there and then they told me that they would give me anyone that's ever been in a hospital where they say, I remember with my daughter's little heart thing, that was the worst. You watched, they actually had a monitor that would, instead of them texting you, they would say, she's in, she's under, everything's great. Like, it was like these little codes, which was awesome. And she's in recovery. You'll see her in, and you could do everyone in the whole thing. It was just numbers.
Yeah.
But this was a little more old school, and it was like, we'll text you when she goes in. We'll text you when she's done. And it took definitely longer than I think I thought it was going to take. And it was really nerve-wracking. And then I remember your surgeon coming out and saying, man, it went perfectly. Everything was great. And I go, amazing. Erika, to recap, had not been able to sleep more than 3 hours for 2 months. Couldn't ride in a car. It was like the worst pain I've ever seen anyone in. We were planning this trip to Montana. We decided there's no way you're coming because you couldn't drive in a car for an hour or fly for an hour. So she comes out and he goes, man, total success. Everything's great. And then I get to see you. And do you know what I remember?
What?
You got to use the restroom. And you go, still hurts. And I was like, what?
Yeah.
And it was worse than before you went in. And I was like, what is happening? And then there was sort of some reassurance that, maybe it's like this residual nerve pain or some kind of thing from whatever. It'll get better. And then hour goes by, 2 hours go by, and it's still the same. Do you remember those moments? I know you were deep into, you had some,
I remember
gave you some shit.
The pain was so familiar for the past 2 months that when I came to and I had the same pain, it was like, okay, maybe it just takes a while to decompress. And I just wasn't used to being pain-free. So for a while, I was just kind of like, okay, whatever.
Yeah.
But then when I saw the nurses and then even my surgeon say like, this is not how it should be.
Yeah. But that didn't happen for a little while.
I was worried. I was like, what do you mean?
Yeah.
Well, yeah.
Everyone said
the whole
just,
night.
It'll go away. Everything's cool.
But the morning, he came in at what, like 7 a.m.? I don't remember when. And was like, stop eating. You're going back to surgery. And I was like, what?
Yeah.
That was scary for me. And I want to be very clear. There was not a single complication. And when I had the repeat imaging, it was just inflammation and blood and swelling. And a lot of it was that I had been very stubborn in resisting surgery for way longer than I probably should have. I truly believe that.
Don't you think, though, I know people that are not doctors like me, when you hear back surgery, there's a lot of negative Yelp reviews on back surgery.
Well, yes, but we should clarify my back surgery wasn't any like spinal fusion or
That's what I think is very important. What's it called?
It's very different. I had an L4, L5 discectomy. So part of the jelly donut essentially was shaved off because it was bulging and compressing.
Such a different surgery.
So it was pushing on this nerve for going on 2.5 months. So the problem is you decompress it, but that nerve has a memory too.
Mm-hmm.
The nerve has been irritated for so long that even though the surgery went fine, the nerve was like, yeah, no, you suck. You put me through hell for 2 months. I'm not going to get better right away. So yes, my surgeon was awesome. I want to be very clear on that.
Oh, he was awesome. You know what I learned?
Repeat what?
I learned because when it was said to me, we're gonna. It wasn't like they said, "Hey, we're doing an additional surgery." The way he phrased it, which is exactly what happened. You did have another surgery. The way he said it to me, he goes, "Hey, this is we just made this incision. If we're gonna go in here, this is so. If we wait 2 months, this is scarring."
Scar tissue.
And then he also said, "You could do this MRI." But what we're seeing on the MRI, because we just did surgery, is going to be nothing compared to what we could see if we just go ahead and go in there.
Yeah, and he communicated effectively. I mean, it helps that he was my friend, but it was nice to know that it was like just blood and inflammation and fluid, and he suctioned it out.
Yeah.
And that was it. It wasn't like an additional surgery. I mean, it was. I was intubated twice. I think that's very important.
Yeah.
I'm like fully like breathing tubes. They like completely knocked me out.
Can I tell you something about when you were...
So it was exhausting.
Don't lose your train of thought because I want to talk about the moment when you were out of the second surgery. But do you by any chance remember? I got to come back with you the second time.
Of course I remember. That was
We begged.
That's when I was having like excruciating pain in any position, and I was like shaking, and I was mortified.
So you're mortified, you're shaking.
Friends with the anesthesiologist, the nurses, I mean, they all knew me, so I was really weak in that moment and like crying hysterically from pain. It was
so right after
awful.
that, I want to ask you if you remember this. The anesthesiologist comes in. He's your new friend. He's my new friend, and we're talking in that he goes, "Would you like this medicine and this medicine? Are you in pain?" And you go, "Yes, I just want to make sure it's safe." And he goes, "Okay, I'm gonna do this and this." And he does it, and then you started feeling better.
Yes.
And you said to him,
I know, Jamie.
You told him I was a comedian.
Yeah.
And then you go, "Man, Jamie does this great bit about anesthesiologists."
Yeah.
And you word for word did with perfect inflection like a 4 or 5 minute comedy bit. It was, and he was like, "Okay." And you were like, "Hey, anybody here?" It was amazing, but it made me feel good because I knew you weren't in pain anymore, and you did a great job.
He gave me, I think he gave me Dilaudid, and I had Valium. I was so high. So the fact that I remembered your bit, by the way, it wasn't like random stuff. I was copying you. I wasn't being creative.
No, you were doing an exact bit of mine. You did a whole bit for this man.
Well, guess what? He also saved my life, and he'll be second row at your show in February in Boise.
Right.
So you got some extra doctor buddies.
Can I say this is like a bit of a sappy thing, but
what?
I've just seen you in so much pain for 2 months, and it was like it was a huge part of both of our lives because I was feeling it was just like it took over our lives, and it was awful. And seeing you go through it was awful. It wasn't awful having to like deal with it myself. You had to deal with it, but it was a tough time. And I remember you came back from the second surgery, and I had not seen you in so long. It was even longer than the first one. Mm-hmm. And I go, "Where is Erika? I need to see if this worked." And so you finally come down. I sat in this room for just 3 hours waiting for you. Mm-hmm. And I see you getting wheeled down the hall, and I think to myself, maybe it worked, and we're going to find out. And they wheel you in, and you sleep for 7 hours.
I know.
You do not move for 7 hours. And I'm just staring at you. And then I finally,
I remember hearing one of the nurses go, "Wow, we can always wake someone up. I don't know why we can't wake her up." I think it's because I got so much, because the surgery was unscheduled, right? So they had to keep me comfortable for hours before I could go back. So I think I was just high AF. And then I had general anesthesia. So, like, I just had a ton of drugs in my system.
You were and you hadn't slept for 2 months, I think is maybe part of it.
I had not slept for 2 months.
You want to hear something so I'm watching you, and I go, I'm not going to turn on... I felt the guilt if I were to even, like, watch a show on my laptop or look at my phone. So I mostly just looked at you waiting for you to wake up, right? I'm starving, by the way.
You have guilt over that.
Because I'm weird. So I'm watching you, and I'm just hoping you wake up. In about 5 hours... I'm like, I'm so hungry. And I was going to wait for you. I was going to order these. We're going to order these burgers from,
we had talked about it.
From Kona. We were like, we'll celebrate with these. We're trying to like distract ourselves.
Burgers.
And so it's 5-6 hours go by, and I'm like, I'm so hungry, and this place is going to close. So I go, let me just order burgers for both of us, and I'll just get it done. So I DoorDash these burgers. You're completely out. I spent 5.5 hours. They bring the burgers. I leave. I pick up the DoorDash. I come back. You're still out. I go, you know what? I got to do something. And so I take my laptop out and I turn on like The Penguin on HBO. And I have a burger in one hand and I have like some kind of dipping sauce in the other. And I think I have like a sweet potato fry. And I take a bite and your eyes open. I was 6.5 hours. I sat there waiting for you to wake up, and then I finally go, I just need a break. And Erika wakes up, and it looks like I've just been having like a
and
party.
I looked at you, and I was like, "Are you eating a burger?"
But you didn't say a word. You just
because you don't eat carbs, and that's what I remember.
Oh yeah, I was eating the roll and everything.
I was like, "You're eating carbs."
I was like, it was so funny that you busted me, and then you fall back asleep. I finish the burger. I hide everything, and you wake up like an hour later, and you still don't say hi to me. You just sort of wake up. You don't even see me. And you get up slowly.
Yeah.
And go to the bathroom, which
the nurses helped me.
Did they?
Out of it.
But
yeah.
barely help you. Like the earlier surgery,
Oh.
2 nurses side by side.
Yeah,
You're
yeah.
shaking, barely taking a step. This nurse comes in and kind of helps you. And you sort of walk to the bathroom, a little bit of her help. You go into the bathroom by yourself without her, close the door, and then I hear the toilet flush, and I'm like, holy shit. And the significance of that is it's very hard to use the bathroom because you're using like your muscles and stuff. So you would be gone for so long sometimes in there. And when I heard the toilet flush, I started tearing up because I go, I think it worked.
I know. I came out and I saw you and the nurse looking at each other, and you looked at each other funny, and it seemed like you were having like that feeling, but I was still kind of out of it.
And it worked.
But yeah, I remember her saying we need to walk in the hallway, and I was nervous. I was like, the last time I did this, it hurt really bad. And instead of having to have the belt and the walker, she let me just hold your hand. And I remember being like just a little ways down the hallway. It's midnight.
Yeah.
You'd been sleeping in a hospital recliner for a day and a half.
Yep.
And I remember I just stopped and I fell into your chest sobbing and told you the pain was gone.
It was wild.
And I saw you like look up and like wipe your face, like this relief. And it, I love you like crazy, and I'll try not to be too sappy, but I truly believe that as much pain and just restriction I had in my activities of daily living because of the pain and how awful it was, I really do feel like the partners going through surgery have a much more difficult time, right? Because I was out of it for how long? And sleeping, and you are awake, worrying.
We're unconscious for a bunch of it.
You feel helpless. Versus the patient is like sedated, or we're so consumed with pain, and we don't feel that guilt. But the partner feels guilty. You feel guilty to watch a show. You feel guilty to eat for the first time in a day. Mm-hmm. So I feel like it really brought to light how supportive spouses, partners, friends, anybody who goes to a surgery with somebody, like they've got the really hard deal. They're the ones that are really suffering. It's hard to... I think it's true.
Yeah, and you're right. You're unconscious for a lot of it while that person is worried.
Yeah.
While you're in there.
Mm-hmm.
Yeah, that's why. But
so I'm fine.
The update is
pain-free. I'm doing physical therapy every day, and it worked, and I'm grateful.
It's amazing. The recovery is not easy, but your other pain is gone.
Of course it's not easy, but you know what? Bitching about it doesn't help, and I think putting in perspective that I could not sleep for more than 2 to 3 hours without being awake for 3 hours in debilitating 10 out of 10 pain. Not even bored, like just mind-crushing pain.
Yeah, that was awful.
That it also puts in perspective little things. Now when something else hurts, I'm like, I'm fine.
Yeah.
If I'm throwing up, I'm like, it'll go away.
Yeah.
No big deal.
Back stuff, and also back stuff is, I don't know that there's an injury that affects more of your life than a back injury.
I think that's what was difficult. It was so inhibitory. Like it was very humbling to have to ask you and my own mom to like put my socks on for work because I just couldn't. Mm-hmm. So it was a lot, but I'm thankful.
What is it? I feel like an important point to reiterate is there are some back surgeries that are fusions and are this and that, but this one, after researching it and after you having it done so successfully, it really is something to look at because you waited a long time hoping that something else would work or it would go away, but this discectomy.
Yeah, well, I think by nature, I'm a more conservative physician, right? I mean, even though I trained allopathically and osteopathically, for anyone listening, that just basically means the 2 schools of medicine. I took boards in both, but I was taught about more natural approaches and body, mind, and spirit and how you can heal yourself, hopefully. And we even talked to someone to try to heal it mentally and see if that could be it. And I tried 5 different prescription medications, physical therapy, 2 epidural injections.
2 epidural injections.
At some point, I had to just, I think what it was is that I tried to sit down and go to work one day, and the pain was so bad. You were there. That's when I had to call in. I've never had to just call in because of pain. So you get to the point where you realize that that's your only option.
Yeah. But that's the update.
I'm thankful. I have nothing but positive stuff to say. And
it's amazing.
I like my scar. I hate scars. I find them to be reminders of painful things. This one truly feels, I feel very like...
Is it lower back scar? About an inch?
Yeah. I'm proud of it, Jamie. Maybe that sounds dumb, but I feel like for how much work we both went through for this one, it's like a reminder that you and I talked about to never take anything for granted again, like to wake up pain-free, to be able to go on a walk, to be able to bend. I sat down to pee for the first time without pain in my back in 9 weeks. And I still think about that. It's like, damn, the stuff that I take for granted. And when I complain that my steak is undercooked or, like the pillowcase is scratchy, like what is wrong with me?
In your defense, that steak was fucking undercooked.
It was disgusting. I didn't want a foodborne illness in my defense.
No, you did the right
snobby
thing
last night.
But Erica's doing great, and it makes me happy.
Thanks.
And I would like to quickly sideline to you and I are not. This is a true thing about your steak. You weren't upset, but we went to this. It's not like it's the Ponderosa or the Sizzler. It's not like it doesn't. We went to a really nice place, and your steak came out.
The prices were quite inflated.
They were a little inflated, so you expect it to, and you ordered a medium rare steak, and it came out, and it really did look like it looked like Rocky Balboa should have been punching it. It was so raw.
It was bad.
And so I think it's interesting. You can tell a lot about a person by what happens when their steak is not done correctly. I think some people are rude. Some people are. You were very nice. Remember, you go, hey, it was purple.
Yeah, it was gross.
And then you very kindly sent it back. And you go, is there any way we could cook this a little bit more?
I always feel bad about sending stuff back. So how about this? If it's overcooked, I'll be grumpy, but I'll eat it. If it's undercooked, I worry about the foodborne illness component. So I'm like, no, I am not going to have raging diarrhea on our romantic getaway vacation. You're cooking it because I don't really feel like,
yes,
crapping myself tonight in the hotel room.
But we're both I think we're both, if a steak is messed up, the way they handle it makes us love all the people. They handled it so well. And we've been to places where and
we're probably going to eat there tonight, right? Because they were so nice.
Yeah.
And we've been to places where they've been super snobby, and we'll never go back, even though the food was really good.
I'm getting the frozen ribeye. Do you remember? Because do you remember?
Ew.
I feel like if I was listening to this, I might think yeah, of course, they're going to take the steak back, and it's not a big deal. The reason I'm even bringing this up is I was FaceTiming with you once, and we're eating dinner together or something,
that was horrible.
and you ordered a steak from a really nice place, and it was completely cooked, completely wrong. And I swear I heard all this happen, or I wouldn't have believed it. You politely, as you did before, said this is crazy cooked wrong, and they told you they weren't.
It was supposed. I don't know.
They weren't going to take it back. They were like, she was like, let me ask the manager.
I have to get permission.
I got to get permission. I was like, what is happening?
And it was in their defense. It was a very nice cut of meat, so I don't think they wanted to waste a second one.
Of course not.
But the manager came over and looked at it and was like, "Oh my gosh, that's wrong," and it was taken care of. I hate complaining.
It sucks.
I'm grateful for what I have, and if it tastes bad, it tastes bad. But if it's undercooked, I worry that I'll get sick. So that's the one exception. Honestly, I can't think of anything else I have sent back. Even if there's hair in my food, I just stop eating it. Or there was a bone in your fish yesterday for spite, and you still ate the whole thing.
That's right, and it was from a different animal, which was upsetting. It was a chicken bone. But yeah, we're not people that send stuff back.
But are we just nice? Or I'm also scared they're gonna spit in it.
Well,
or do something even worse to it.
I worked at a lot of restaurants.
Yeah, did you spit in the Arby's roast beef?
Never once.
Well, you're a nice man.
And it was also, not Arby's. I worked at actual, pretty, not fine dining, but nice dining. You know what
happens, or why would they have ever made that movie about it?
Well,
of
because
course it happens.
But that's a diet, in a nice place.
Are you kidding? Everybody has bad days.
Yeah, but
What if it was their worst day? What if they were gonna turn in their 2-week notice anyway, and you're like, you don't know how to cook this steak,
I'm sure it happens in some places.
and they just got in a car accident on the way over, and their girlfriend broke up with them, and
Okay. Let me tell you something. If that happened to you, go ahead and stir my coffee with your penis, okay? Take whatever it takes to make you feel better.
How would make? Well, I don't think that would make anyone feel better.
You know
if
what
they
I
put
like?
Their penis in a hot cup of coffee.
Well, last night the
No.
place we went had you could see them cook. I like when they do that. Did you see that?
So does
You
it
can see 'em.
prevent the spitting then?
That's why
Or
they do
they
it.
go around the corner? They go around the corner.
No, you keep that where I can see it.
I don't think so.
You keep that. Sometimes I tell them, I go, hey, this is undercooked. You keep it where I can see it.
Well, there's
I
also
don't let 'em.
counters. They can just dip under the countertop.
I'm sure it's happened. But I
Of
feel
course
like
it's
the nicer the place,
happened.
the less likely
I like to be very polite with anyone who has any control over something I will be consuming. You like to be very polite with the doctor who's going to do your colonoscopy, as you like to tell people.
That's true.
Why would you offend someone that has control over something that could affect your body? Right?
That's really true. They really do.
Like your dentist, you're never going to walk in your dentist and be like, I hate you. And then have the hygienist be like, excuse, what did you just say? I'm going to dig a little bit deeper on that plaque.
There are people that you have to be nice to.
However, what about all of the people who don't have that insight, who are complete jerks?
Yeah.
Like mean people who come to see me and they yell at me.
How many?
And then I'm supposed to do a procedure on them and I'm shaking because they've been screaming at me. And I'm
Yeah.
like, you're lucky I'm a nice person, but like,
how many
people would be like, F you, we're done.
And if they're like that at a restaurant, how many undocumented dick germs have they ingested?
That's what I'm saying.
Yeah.
I mean that. I mean that if you tick somebody off, not everyone's nice like us, and a lot of people are crazy.
Do you know how nice I am? I'm going to go next level nice.
Oh.
You know how hard it is to get a dentist appointment? You got to wait 6 months, and then it's time to go. You don't want to go. Once you get yourself there, the best thing ever. I think one of the best feelings in the whole world. Sometimes I lose my wallet, and when I find it, I go, I'm glad I lost it. I wish I could bottle this feeling of finding this wallet. Feels good.
Not
Feels
everyone-
better than if I had never lost. The dentist?
No.
Walking out of the dentist is a wonderful feeling. Do you agree with that?
No.
Your teeth are clean?
Not a big fan.
But don't you feel like you did it? Like you accomplished it? You got it over with?
I mean, same feeling as paying a bill. I'm not like dancing on clouds.
Oh, really? Because I hate it so much that when I'm done with the dentist, I feel such relief that it's 6 more months. And the other day, I went to the dentist and I got in there. I went through all the stuff. They sat me in the chair. She takes out the thing and she does 3 teeth. And then she goes, I'm really sorry. I got to go. And I go, what are we talking about? She says, there's been a family emergency. And I go, okay, just tap the other hygienist that's going to come in and finish this. And they go, oh, there isn't one. And I was like, son of a bitch. But it was really nice.
Well, you were very nice. But what if they were like bleaching my hair and only half of it was done and they had to run out?
That's what Whoopi Goldberg looks like lately. Have you seen her lately on
just
The
saying.
View? She looks like she was getting a haircut and the power went out.
I'm so gross. Mean. I'm sorry. Well, I don't even know what I mean. Well, you know what?
Why don't you
I'm
feel
s-
good at you don't feel good walking out of the dentist? Like you just accomplished something? It's just not a big deal. I feel
guess.
such relief.
I don't know.
Want to hear a horrible thing that happened to me once?
No.
It's not great. It doesn't make me look that good.
I feel like I don't even have an option.
I'm not going to say it.
Oh, wow, I did have an option.
I'm going to say it. There's this guy
That's what I thought.
on this movie that we were doing, and he was the prop master, which is like a pretty...
Is that who like has to make
Good
sure in
for-
every scene, like if the mug is like blue, they don't accidentally switch it out with a green one?
Well, that's more the continuity person that makes sure you don't switch it, and they take a picture of it.
Let's go
when
back
people-
to that
But
after.
prop is so continuity.
Okay, well, let's go to the prop one first. I'm sorry I interrupted you. I just didn't know what it was.
No,
So what's
that's a great
prop
question.
person?
Continuity is making sure the plate's in the right place, and they go, "Hey, whenever you point, you take a bite, and then you said that line, so it matches."
would be
But then
so
prop
hard.
is the one that provides to make sure there's no brand names, to make sure you have the props, whatever.
Got it.
And this prop guy, I don't want to tell this story. I'm going to tell a different version of it. I feel like it's disrespect. This prop guy, that's a great job. I think it's the prop master's the head guy. Great job, and he's doing it on movies. His it looked like didn't have the dental insurance. It looked like he had not.
This whole story was just to make fun of someone's teeth.
Oh no,
Oh.
there's more, but I don't know if I should say it. So he basically, it doesn't make any sense because he has a really good job, but he probably has great insurance.
Okay.
But his teeth look like he's never been to the dentist. And I was like talking to someone, and I might have said like, man, it's kind of weird. This guy looks like he's never been to the dentist and he has like a good job. And then he got in the car, like we were driving him somewhere, and we were talking, and for some reason the dentist comes up. I go, this is not.
You mean because you just brought it up?
I don't think I did. He did.
Yeah,
he did.
Right.
And he said that he had as a kid, a horrible, painful dental experience. He just brings up, and maybe that's what he's doing, the disclaimer, and he can't go back. And a friend of ours had a similar thing. Can't go to the dentist. Hasn't been in like 8 years because he had somebody hurt.
So they'll actually provide anesthesia for that.
For like
I don't mean like just laughing gas. They can put you under general anesthesia if you have severe anxiety and need substantial dental work.
It's general where you're just totally out.
Yeah.
Well, I don't know. Why can't I do that?
Because it's unnecessary and there's a lot of risks. There's cardiovascular complications. You can not wake up from general anesthesia. I was intubated twice in 23 hours. That's not a joke. It's a bad thing. You don't want to do that.
So you're saying it would have to be an extreme exam? It would be.
For
but
children.
What if my friend hadn't gone in 10 years?
So for children, if they need like a few teeth pulled, a lot of the times for patients who have any type of mental incapacity, so they wouldn't tolerate a procedure, right?
Yeah.
So for different handicap conditions, we'll sedate people.
But you shouldn't do it. It shouldn't be taken lightly. You shouldn't be like, I'm going to do.
No,
I'm gonna go
it's not like, I don't want to feel a shot in my mouth. No. You need to. It's for extreme cases, but it's for like people who can't sit still because they're unable to. Cognitively, they have such anxiety.
I got a question.
Yeah.
My answer is dentist. Least favorite appointment to go to.
Gynecologist.
Oh, really?
That's why I love my job.
What do you mean? Because you're better at it and you can make them feel comfortable.
Yeah, because
it's
incredibly invasive.
Yeah.
And uncomfortable.
I'd imagine.
It's really uncomfortable.
I heard the breast exam thing is really uncomfortable.
Of course it is. But I mean, just think about it.
Is that worse?
No. You're getting a foreign object put into your vagina and then it's opened larger than the size of a penis and then an instrument is put all the way inside of you and swirled around and it's
what are they trying to do?
I'm testing the cervical, the cells, basically.
There's no better way to do that?
No.
They can't go, no one can invent a soft tool?
It is soft. The brush is soft, but I mean, it'd still be like me brushing the inside of your butthole way up high. Like you'd still feel it.
I should do that.
But if you think about it, it's even more so, it's so emotionally difficult for so many women, obviously.
It's harder to be a woman. I've told you this many times.
To see a gynecologist, I have a lot of anxiety over it myself when I've had to go. So that's why I pride myself in that. I'm more proud of performing pap smears and pelvic exams and having a woman say, "You're done. That's it."
Yeah,
it's the best I've ever. Are you kidding? That is the best compliment I've had people tell me I've saved their life. I have saved a couple lives. And that sounds so egotistical, so let's just brush over that.
No,
I got lucky, let's be honest. I don't know what I'm doing. But I've had people thank me, and I'm like, yeah, well, that's my job. But for some reason, especially women who have been victims of sexual assault and have not been able to have an exam for a decade and they need the testing,
that's good.
For them to feel comfortable to me and me be able to say, we've got this together as a team, you and me, and then successfully do it, it's the best thing I've ever done in my job.
That's a good one.
Delivering babies was the other really cool.
Well, that would be fun.
It was pretty cool.
My sister does more baby stuff. She loves that.
There's bad stuff in medicine too, though, right?
I'm sure.
There's a lot of, but I don't know. I think it's cool.
Good answers.
Oh, thanks.
So,
I make a lot of mistakes too. I'm not self-righteous, just so you know. I admit every day that I mess up to my patients. I'm not the best doctor out there, but I give a shit.
Well,
I guess that sets me apart.
People make mistakes. Well, I think a lot of them give a shit, right? Or you don't think they do?
Well, it's just not a moneymaker for me. I really sometimes will sit with a patient and cry over stuff that's happened with them. I've cried to patients when they've shared stories, and I've allowed myself to feel it. And I just last week had somebody tell me a horrible story, and we hugged and cried. We'd never met before. And she's like, it helps me just to talk about it. Thank you. And that was the entire visit. And I think sometimes, especially post-COVID, a lot of people need to hear that their doctor's human and cares and is listening to every part of them, and not just, you have high cholesterol, here's a medicine or a lifestyle change. But, oh my God, all of this stuff happened to you. Here's this scientist. And they actually care.
That's nice. Yeah, I think I told you, but...
Sorry.
It was just cut out a tiny bit, but I think you're okay.
Well,
Erika was kicking the mic cord.
There's a lot of wires. I don't like them.
I didn't want people to not hear what you were saying.
I wanted to condense them.
I wasn't trying to be a dick. I just thought it cut out, and I didn't want you to be telling this beautiful story.
I wanted to condense all the wires because I didn't want to trip over them, and I'm a little bit OCD, so I wanted them all in one nice little pile.
So, we're in Montana.
Yeah.
We're gonna wrap up this episode, and but man, I think we covered a lot of good ground. Erika's doing great. Very, very grateful for everything.
Yeah.
That your surgeon did. And I really think, I know there's a lot of people that are real scared of that back surgery. The discectomy, in my opinion, a little bit different. Do some research.
Careful. This is not a medical advice
do research.
show.
I said do research.
No,
I didn't say do anything.
Huge disclaimer. All of this is for entertainment purposes only, and there's no actual medical advice. If you have any medical problems, please consult your own personal physician, a.k.a. please do not sue me. Thank you, and shut up, Jamie.
That's a great ask. What should we call this episode?
Shut up, Jamie.
All right.
Don't
Erika's
sue me.
This episode is called Don't Sue Me. Until next time.